I will talk about the maternal-fetal conflict by Christy Cummings and Mark Mercurio. Maternal-fetal conflict is when there is an ethical challenge and dilemma concerning the pregnant woman and her fetus. Maternal-fetal conflict occurs when a pregnant woman refuses medically induced labor or C-section, if the mother uses illegal drugs or non-prescribed medication, or when she does not adhere to prenatal care or a recommended treatment for her own or her fetus' medical condition. Some argue that the terminology maternal-fetal conflict should be avoided and use maternal-fetal relationship or maternal-physician relationship. They say that the conflict is not with the mother and her fetus, but with the medical team. Although this term does have its limitations and connotations, there are cases to which the conflict does lie with the interests of the fetus or future child and the mother when she refuses medical treatment or advice. Another terminology controversy are the terms fetal interest and fetal patient. They tend to assume that there's a distinction between the pregnant woman and the fetus and may erroneously provide disproportionate weight to the fetus, which may infringe on the pregnant woman's autonomy. For maternal-fetal conflicts, we can use the traditional principle-based approach, which includes respect for autonomy, beneficence, non-maleficence, and justice to evaluate these cases. Fundamental ethical issues are the woman's right to autonomy, justice to the fetus or future child, the pregnant woman's moral obligation, and the obligation of the professional to the woman and fetus. Cumming explains that feminist ethics of care approach can better evaluate and enhance the analysis of cases that involve maternal-fetal conflict if used synergistically with the principle-based ethics. I agree. Feminist ethics supports groups that historically experience oppression, dominance, and bias. It allows for a wider concept of autonomy, and there's an effort needed to understand the unique context in which women live, the difficulty in assessing medical care, and their predisposition of systematic oppression related to ethnicity, socioeconomics, and politics. The way of the moral status of the fetus raises concern and will influence how much fetal interest would count. But despite the controversial moral status, many argue and claim that a pregnant woman who is planning to be a parent has a moral obligation to the fetus, and the physician caring for the pregnant woman also has a moral obligation and duty to protect the fetus as a potential patient. Bonnie Steinbach explains that parents have an obligation to avoid exposing children to serious harm, and this also applies to maternal nutrition and the use of alcohol and drugs, etc. Cummings further explains that although we accept that the pregnant women have this moral obligation to the fetus, it does not mean the physician has the right to enforce those obligations. In conclusion, one would agree that one should respect the woman's autonomy while also attempting to minimize the potential harm to the fetus and future child. The fetus's right to beneficence, many say, is a strong one, but it does not trump over a pregnant woman's autonomy, even if her decision is unwise, immoral, and unconscionable due to the potential harm of the fetus. She still had the right to make those decisions. Does this mean that the woman's to autonomy should be absolute, or could there be a threshold that establishes the justification to restrict the woman's autonomy? I think these kinds of cases are unique. Cummings asserts using solely the principle-based ethics have limitations as it lacks, ignores, trivializes, or demean values and virtues that are culturally associated with women. It would be of great help to evaluate these ethical questions with the model of feminist ethics of care. It promotes a focus on mutual needs of the woman and the fetus within the context of this relationship and community, rather than those needs that may be in conflict. This principle urges the physician to see women and fetus as a single entity instead of identifying each distinctively, having an obligation owed to each other. So instead of punishing and criminalizing the woman for prenatal harm, the physician should advocate prevention and healthy behavior and treat her addiction as a medical and psychiatric treatment. American College of Obstetricians and Gynecologists recommends that physicians promote the health of women and their fetus through advocacy of healthy behavior and support, referral for substance abuse and mental health services, and to develop safe, available, and efficient services. Punitive measures should be avoided as these types of measurements are shown to be detrimental